Why are pancreatic vitamin deficiencies misdiagnosed? Have you ever wondered why pancreatic vitamin deficiencies are often misdiagnosed? This issue is more common than you might think, and it can lead to significant health concerns. Let's explore the reasons behind this misdiagnosis. First, the symptoms of pancreatic vitamin deficiencies can be quite vague and overlap with many other gastrointestinal disorders. Symptoms like bloating, diarrhea, abdominal pain, fatigue, and weight loss are not unique to pancreatic issues. They can also be seen in conditions such as irritable bowel syndrome, inflammatory bowel disease, and celiac disease. This overlap makes it challenging for healthcare providers to identify the root cause without thorough testing. Another reason for misdiagnosis is the lack of awareness and testing for exocrine pancreatic insufficiency, or EPI. Many healthcare providers may not routinely consider EPI, as it is less common and not well known outside specialized care. Patients can go years, sometimes 5 to 8 years, before receiving an accurate diagnosis. Testing for pancreatic function is not always performed, and some tests can be invasive or rarely used. Instead, less specific tests may be conducted first, which might miss EPI altogether. The complexity of underlying causes also plays a role. EPI can arise from various conditions, including chronic pancreatitis, pancreatic cancer, cystic fibrosis, diabetes, and gastrointestinal surgeries. Some of these conditions directly damage the pancreas, while others affect enzyme secretion indirectly. This complexity can confuse the clinical picture and delay the recognition of pancreatic insufficiency as the cause of vitamin deficiencies. In some cases, patients may have mild or moderate EPI, especially those with diabetes or early-stage pancreatic cancer. In these situations, enzyme deficiency and malabsorption may be subtle and not immediately obvious. Vitamin deficiencies can develop slowly, and early signs might be mistaken for general nutritional issues or other systemic diseases. Additionally, vitamin deficiencies are often secondary to pancreatic issues and may be attributed to dietary causes or malnutrition. Clinicians might not suspect pancreatic dysfunction, especially if the disease is not yet diagnosed. This can lead to a misattribution of the deficiencies to other gastrointestinal diseases. Conditions like celiac disease or inflammatory bowel disease can also cause malabsorption independently or alongside pancreatic insufficiency. This overlap complicates the clinical picture and can delay the correct diagnosis and treatment of pancreatic causes of vitamin deficiency. Understanding the connection between pancreatic health and vitamin deficiencies is crucial, especially in the context of pancreatic cancer. Pancreatic cancer often leads to EPI, which can worsen patient outcomes if left untreated. Early diagnosis and treatment with pancreatic enzyme replacement therapy and vitamin supplementation can significantly improve quality of life and nutritional status. To reduce misdiagnosis, it is essential for healthcare providers to be aware of the signs of pancreatic insufficiency. Using appropriate diagnostic tests and considering pancreatic causes in patients with unexplained vitamin deficiencies or gastrointestinal symptoms can lead to timely and accurate diagnosis and treatment. In summary, pancreatic vitamin deficiencies are misdiagnosed primarily due to overlapping symptoms with other gastrointestinal disorders, underutilization of diagnostic testing, and the complex nature of underlying causes. Addressing these challenges requires careful clinical evaluation and awareness of the links between pancreatic disease and vitamin deficiencies.